Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. This is my daily briefing. Today is Monday, March 23rd, and as many of you could probably hear in my voice, I am fighting a little bit of a cold today. This is a good opportunity for me to remind everyone that while we know that there's COVID-19 circulating, we are also still seeing a lot of other things circulating as well, the common cold being one of them. There's also still flu in our community. A lot of people are starting to experience allergies as the weather has gotten nicer and things are starting to bloom. So just keep that in mind whenever you're out in public and trying to run your errands or do your grocery shopping, that not everyone who has a little congestion or a cough has COVID-19, because we are definitely still seeing some of these other viruses in our community as well as allergies. So as of today, the number of cases in Missoula County still holds at 4. Other areas in our state are starting to see an uptick in cases. The numbers in Montana have almost tripled since March 18th. This could be due to increased testing and delayed reporting from private labs, but we still need to take the additional numbers seriously. Gallatin County is starting to see community spread. There's no evidence of community spread in Missoula County. All of our cases have been related to travel outside of our community, but that could change at any time. So it's really important to continue to adhere to the social distancing measures that we keep talking about, because that's what's going to be vital to delaying the community spread and minimizing the potential effects in our community. So when we talk about social distancing, what we really want you to keep in mind is that social distancing means providing 6 feet or more between you and another person. Experts are now advising that groups greater than 10 people should be held either remotely or postponed. Any gatherings with more than 10 people should be held remotely or postponed if possible. Non-essential meetings should be canceled or postponed. If you are a member of a vulnerable population, it's really important that you try to stay home as much as you can at this time. Some of our grocery stores and other services are offering specific hours of operations for people in vulnerable populations, so you should definitely keep that in mind. If there's a way for you to reduce your exposure to the general public, that is the best thing for you. And if you can have a friend or a neighbor or a family member run some of those errands for you, then that is also advisable at this time. We also want to remind people that our governor, Governor Bullock, expanded on our health officer closures issued locally last week. So on March 20th, Governor Bullock ordered the closure of the following businesses, except for those who can provide service by takeout, drive-through, or delivery. And I'm just going to read from this list because it's pretty extensive. So that includes restaurants, food courts, cafes, coffee houses, and other similar establishments offering food or beverage for on-premise consumption. Alcoholic beverage service businesses, including bars, taverns, brew pubs, breweries, microbreweries, distilleries, wineries, tasting rooms, special licensees, clubs, and other establishments offering alcoholic beverages for on-premise consumption. That includes cigar bars, health clubs, health spas, gyms, aquatic centers, pools and hot springs, indoor facilities at ski areas, climbing gyms, fitness studios, and indoor recreational facilities, movies and performance theaters, nightclubs, concert halls, bowling alleys, bingo halls and music halls, and casinos. So currently the governor's order goes through March 27th, but it is quite possible that he could extend or modify that order. I've gotten some questions and concerns from people that, say, okay, well, when that March 27th comes, then we can just be right back open for business. And I just want to say that at this time, we don't know what that's going to look like. But what we do know is that if we reopen everything all at once, then all we've done was bought us this little 2-week delay, and then we're going to see a spike in cases. So when we do start opening things back up, it's going to have to be done in a very controlled and methodical way in order to continue to flatten that curve. Just because if we do go from everyone not congregating to suddenly everyone's congregating all at the same time, then we're just going to see a huge jump in cases. And on that note, the other thing that we need to keep in mind is the governor's advisory that went out last week is that anyone who traveled internationally are asked by the governor to stay home and isolate yourselves for 14 days. Anyone traveling back from a level 3 country that has widespread or sustained COVID-19 must report their travel to the health department. So we want you to call 406-258-3896 if you're a Missoula County resident and you've traveled to one of those level 3 countries that has widespread or sustained COVID-19. Domestic travel does not require any action at this time, but I want everyone to just keep in mind that that could change as we start seeing more cases or more community spread in other areas of the country. So when we talk about high-risk populations, I just want to give a little bit more information about that because we've been getting quite a lot of questions. So who is at higher risk? So right now what we know and the guidance from the CDC is that older adults, which is people over the age of 65, and people who have serious medical conditions like heart disease, type 1 or type 2 diabetes, or underlying lung disease definitely fall into that high-risk population. According to the CDC's March 18th report, preliminary results are showing that severe illness leading to hospitalization, including ICU admission and death, can occur in adults at any age. But older adults are definitely more likely to have worse outcomes. Between February 12th and March 16th, 31% of cases, 45% of hospitalizations, 53% of ICU admissions, and 80% of all deaths occurred among adults 65 and over. In contrast, persons 19 and younger appear to have much milder illness with COVID-19, with almost no hospitalizations or deaths reported in the United States. So sorry to be reading those numbers. I just wanted to make sure that I got it correct. So some of the other people that might be at high risk of having worse outcomes with this disease are people who have asthma. And that's because COVID-19 is a respiratory, it's a respiratory disease. So it can cause you to have an asthma attack and possibly lead to pneumonia and acute respiratory disease. We don't currently know if pregnant women have a greater chance of getting sick from COVID-19 or whether they'll have a more serious illness as a result. Pregnant women, as we know, experience a lot of change in your body when you're pregnant. And so with the virus from the same family as COVID-19 and other viral respiratory infections like the flu, women have had a higher risk of developing severe illness during pregnancy. And so it's always important for pregnant women to protect yourself from illness. And like I said before, that we're still seeing a lot of other respiratory illnesses as well. So definitely something to keep in mind. We also don't know if COVID-19 can cause problems during pregnancy that might affect the health of the baby after birth. Because this is a very new disease, the research just isn't out there on that. So another good reason to really protect your health if you're a pregnant woman. The other thing is that people who are currently living with HIV, there's not a lot of data on how COVID-19, how severe of illness you might get with COVID-19 if you're currently living with HIV. The CDC is going to be updating their page for persons living with HIV as soon as information is available, and we will definitely be getting that information out to you. Another big question that we've had is when can someone return to work? So the CDC guidance changes pretty frequently on this topic, and we will keep you updated as we get more information. Currently, the return to work criteria is if you've tested positive with COVID-19, a public health nurse is going to check in with you regularly, and they will let you know when you can go back to work. If you are not tested, but you were instructed by a healthcare provider to stay home, we're asking that you please do so. I know that right now we're starting to have a little bit of a hard time getting a hold, our healthcare providers are having a hard time getting a hold of some of the supplies that they need in order to do the test. And so they're trying to reserve some of those tests for people who work in high risk conditions like healthcare providers or first responders, and also for those that are severely ill or have a or fit into those high-risk categories and could have really poor outcomes from getting ill. So that's why we're saying if you were instructed by a healthcare provider to stay home and you were not tested, then definitely follow their guidelines. If you are asymptomatic but asked to stay home after travel or exposure, we want you to remain home until your 14-day incubation period has passed and a public health nurse has cleared you to return to work. So that's if you traveled or you had an exposure. We want you to stay at home for 14 days during the incubation period just to make sure that you're not going to actually develop symptoms from this disease. And a public health nurse will let you know when you can go back to work. If you don't have COVID-19, but you have another respiratory illness, it's important to remain home until your symptoms are resolved or as directed by a healthcare provider. So another thing that has come up in the over the weekend is the question about gloves. So we're starting to see a lot of people in the community wearing disposable gloves. And so we just want to take a minute to dispel some misconceptions related to disposable gloves. So gloves are not actually helpful in preventing the spread of COVID-19 for the general population. Using gloves improperly could actually create a false sense of security and can deplete a resource that is needed by our healthcare workers because gloves are definitely starting to be seen as a shortage area where our healthcare workers are having a harder time getting a hold of them. Gloves are not a sanitizing surface, so if you touch a surface contaminated with COVID-19, the virus gets on each additional item that they touch. So delivery drivers, checkers at businesses, other people who are wearing gloves are not benefiting themselves or others, especially if they touch their face or their water bottle or something else with contaminated gloves. So where gloves are effective in battling COVID-19 is in the healthcare arena because those healthcare workers are coming into contact with a lot of different patients. And so, they need to be able to dispose of their gloves, wash their hands, and put on a new pair of gloves before they see another patient. So that is where it definitely is appropriate for gloves to be used. If you're concerned enough to wear gloves, then you just need to make sure that you are washing your hands or using hand sanitizer after touching any unclean surfaces. So that's all that I have for my daily briefing. I know this one is quite a bit longer than the rest. We've been sort of collecting some different questions and feedback over the weekend, so I just wanted to make sure I touched on all of those points. I will see you all tomorrow. Until then, stay healthy.